There will be. Thanks, Sam. For women diagnosed with breast cancer, surgery can greatly impact the way a person views themselves. And today, there are many options when it comes to breast plastic and reconstructive surgery after undergoing a lumpectomy or a mastectomy. So here to talk about it, plastic and reconstructive surgery available to women is Dr. Elizabeth Stirling Craig, the director of Microvascular Breast Reconstruction at Hartford HealthCare. Doctor, welcome.
Thank you for having me.
Oh, this is such an important topic, and we love covering it every October and beyond. What are the benefits and risks of breast reconstruction?
The benefits are really to allow the patient to wake up with as little of a visual reminder of being diagnosed with breast cancer. So if they've ever wanted smaller breasts or larger breasts or even perkier breasts, we provide the silver lining, and now is the time to be able to get that result as we rebuild the breast from the start.
That's a great way to look at it. All right, what should women expect after undergoing a mastectomy or a lumpectomy?
You know, nowadays the recovery is quite similar for both. There's very little pain with either of them thanks to our anesthesia colleagues. For a mastectomy where we're rebuilding the entire breast, we often use implants, which a lot of patients are familiar with. My background and expertise is in fat transfer, so using their own tissue is now a growing option. For a lumpectomy, oftentimes we will use extra breast tissue to move into the area where the cancer was removed, and then we will lift the breast at the same time.
All right, doctor, what is the most common breast reconstruction technique?
You know, I think every plastic surgeon probably has a different experience, of course. I do a lot of fat transfer, so I see perhaps patients from other plastic surgeons that don't do quite as much of that. But I think nationally speaking, for mastectomies, implant-based reconstruction is certainly the most common. But in my practice, I probably see more natural tissue.
All right, innovations in breast reconstruction surgery, they've greatly improved in appearance in recent years. Tell us about the different reconstruction options that Hartford HealthCare offers.
So we offer everything cutting edge. So fat transfer, implants, oncoplastic reductions and lifts. I think in particular what is the most exciting is improving a patient experience as a whole. Now that we've really brought reconstruction to where it should be, we've really utilized our anesthesia colleagues to provide the best post-operative experience with patients really having little to no pain after the surgery, which is quite big.
And what do patients say, or how do you feel when you're able to recreate the patients and change their lives?
I mean, there's no other better gift. I mean, that's the reason why I love my job and why we, spend endless hours in the operating room trying to get these patients where we think that they'd be the happiest.
Oh, well, Dr. Elizabeth Stirling Craig, thank you so much for joining us with the latest on breast reconstruction at Hartford HealthCare.
Thank you.